Hello everyone, my name is Denise and I'm going to demonstrate how you draw blood. We're going to demonstrate for those of you who do not know or who need a fresh up on how to draw blood, and also our new hire, a new PCA who needs help drawing blood, so I'm going to show her how to draw blood, okay? Alrighty, first of all, when you enter a patient's room, you want to introduce yourselves, let your patient know what you will be doing. Let them know you're their PCA, their nurse, and let them know you'll be drawing their blood. Okay, so hello Miss Andrea, I'm Denise, and this is Miss Bintu, and we're going to draw your blood today, okay?
Okay.
Next, after you want to do that, you want to verify the patient, and verify it with the label that you have, and you want to verify their ID as well. You want to check their ID, make sure it matches their name and the label's name, and then you want to also ask them their date of birth. Can I see your date of birth, please? Alrighty. Okay, can you tell me your date of birth?
6/25/72.
Okay, thank you. Alrighty, now after we begin, before we begin, we want to always wash our hands, make sure we have good hand hygiene. Okay, so we washed our hands already. After that, we want to make sure we have all our supplies. You're going to be needing your butterfly to draw the blood. You need a tourniquet to wrap the arm up. You need alcohol pad to clean the area that is suspected for a vein. You want to have some gauze pads just in case patient is on blood thinners. You want to have more gauze pads, that way if the patient is bleeding excessively. And you want to have a Band-Aid to put over that gauze pad. Okay? Alrighty. So we're going to put on our gloves. Okay, and it's best if you usually just start off with one glove. That way you can fill the vein with the other hand that does not have the glove. Okay, so I'm going to wrap the tourniquet around. You want to tie it tight, but not too tight, because veins will just disappear. Yes, you can see. Alrighty. There we go. And we have some pretty good veins up here. Here's some really good veins. Right here, they're popping out right there. So that's some really good veins. Okay, is this okay, Miss Andrea, if I go into these? Alrighty. You always want to ask the patient, make them feel comfortable. Alrighty. So once you feel for your vein, you want to stick on your other glove. Okay, you want to have all your materials ready. And you always want to make sure the tubes are in the correct order. There are certain reasons, so you always want to check with your hospital policies and make sure they're in the correct order that the labs are supposed to be drawn in. Is your arm okay? Feeling okay right now?
That's pretty good.
You really don't want to hold over a minute, so if you're holding over a minute looking for a vein, you just want to loosen it up before you actually do begin the process. So it was a little bit over a minute, so we'll just tie that while we prepare this. Alrighty, so we have all our material ready. Now usually our patients are on our beds, so you want to adjust the patient's level to where you can have a good position to draw their blood. It's actually really good. Thank you. Okay. So we're going to have our first tube just resting in the butterfly holder. Okay. Let's tie this up. Alrighty, and you want to feel for the vein, make sure it's not a rolly vein. I'm going to dry off the vein, or clean the vein off for 30 seconds. And then we have to fully let it air dry. You don't want to wave it or anything, you just have to fully let it air dry, okay? Alrighty. Could give false readings if you read it with some alcohol in there, so it could give some false lab readings. Alrighty. You always want to let the patient know before you insert the needle, that way they don't jump or act like they're surprised. You want to pull the skin back taut. Okay, and hold your thumb about an inch away from the site you're going to draw, okay? Alrighty, Miss Andrea, I'm going to draw you now, okay?
Okay.
1, 2, 3. Okay, we got a little flashback right here. So that is your cue to tell you to go ahead and puncture the tube in. There we go. Good flowing blood.
Yeah. Do you know his name?
Okay, and once you're done, you pull the tourniquet off. Okay, and you want to apply pressure. Apply pressure for about a good minute. Place the Band-Aid over. Alrighty. There you go.
All right.
Does anybody have any questions?
Good job.
Any questions?
No.
Okay, one more detail. If you have an IV, let's say she has an IV up here, we're going to have to stop the IV for about 2 to 5 minutes, usually 5 minutes, that way we don't get a false reading, and we'll draw her down below. But we drew her down below, so it's good to go. Thank you everyone for attending my speech. Thank you, it's greatly appreciated.
Thank you.